I'm Mahmood Adil. I am a global data and digital lead for Royal College of Digital Health lead for Royal College of Physicians, also former medical director of Public Health Scotland and advisor to the Minister of Health of Qatar.
That's very impressive. And could you please walk us through your educational journey?
Well, I think that you're taking me many years back. So I did my medicine, and then I embarked on my training, and my training did start in Scotland. So I did my Masters of Public Health from Glasgow University. Then I did my postgraduate certificate in economics from Aberdeen University. And then I continued my training in medicine, then public health medicine, then management at Harvard, and then at Yale. And then I did my informatics. So I think it's a long journey, but it is very purposeful journey.
Yeah, that's very impressive as well. And could you please tell us more about why did you decide to do the certificate in Aberdeen?
Right. I think when I was doing my training, I was trained in pediatrics. I was in Kent in Maidstone, which is
Hmm.
down south in England. And at that point, I realized that it is the health resources or financing is becoming very important. I was a clinician and still a clinician, but more thinking about health system. And then I realized I need to understand how the health economics work. And when I look around, I felt the Aberdeen has got the best unit. And I remember it was led by wonderful people over there, Gavin Mooney and number of others. And that's the reason I started it in Aberdeen.
Yeah. And what are some of your favorite memories from Aberdeen? Maybe from like social life with it.
I think there are two things. One, I think mostly it was a distance learning, but I had few weeks in Aberdeen,
Hmm.
and I spent most of my professional life in Scotland, so I know Aberdeen very well. So I think the social life wise, I think it was very hectic. I was coming out of on calls and then traveling and doing my work for my certificate. But I think that's the nearest I can think of.
Very interesting. Very interesting. And if you had to summarize your career journey, yes, what would be key milestones?
I think the key milestone could be on the two front. One is maybe the academic side, that what anyone can try and achieve. And the other is the professional side, that what you can work on and deliver along with other people. So on the first front, as I said, I think maybe in the 7 or 8 discipline in medicine and into health system management, that these are my keystones and the key milestones. And on the professional side, I think I was very privileged to work and serve the NHS in a very key positions. And then these key positions are not just titles, but they give you the responsibility so that you can deliver for the best of the people. So I've been medical director for to establish the Care Quality Commission, medical director of Public Health Scotland, National Quality and Efficiency Executive in Department of Health for England, and then, of course, being advisor to the government of Turkey and also to Qatar. And along with that, there are a number of other things I did.
That's absolutely phenomenal. And how did you end up working for Turkey and Qatar, living in UK?
Yeah, I think it's a flexible arrangement you can make. The question is that if a country or the Minister of Health of that country is keen to utilize my experience and in particular to learn from the NHS where I served for most of the years, and I can transfer and translate that experience to help and improve the health system of other countries, then those flexible arrangements can be made. But question is always that what you want to do and help that country on.
I see. Interesting. And what is your current role and what are your responsibilities and how does your typical day looks like?
Well, I mean, my I've got a little bit of portfolio arrangements now. I'm also professor at the university, for example. I'm professor, a clinical professor at Qatar University with a focus on healthcare innovation. So I think that involved teaching, that involved entrepreneurship, that involved to help
Yeah.
startup companies. And when I think about my role at the Royal College of Physicians, it means that I need to help the forthcoming generations of clinicians that they need to develop the data and digital literacy. I need to help the college as well as the 12,000 the global members and fellows
Mhm.
that how best the
Wow.
digital health can help them to improve the healthcare.
Wow. Wow. And you work in a few different countries, and how their approach to like health, like health industry, helps, sorry, health in general, yes, is differs from each other.
Look, if you look at any health system, it has got six core elements. It
Hmm.
needs to have a governance and leadership. It needs to have finances. It needs to have data and intelligence. Then need to have a healthcare workforce, the fourth one. And then the fifth one needs to have a health service delivery system, the hospitals, the
Hmm.
primary care units. And then last but not least, it needs to have the medicine and the products. So these are the six core elements defined by the WHO, World Health Organization. So if you look at any country, then I would define the countries as the systems at maturing health system and matured health system. So that is where the difference comes in. So if I just give example that the NHS is a very matured health system, established in on 5th of July 1948. Over the years, all six core elements of the health system got very mature.
Hmm.
When you look at other health system, like I've been in Qatar and the Turkey, and I've been advisor to many other countries, then they have got certain elements, they are very strong, other elements, they are still maturing. For example, Qatar, it's got a wonderful leadership, small country, and then it has got a population of about 2.8 million people. And then if you look at the finances, they have invested in building the new hospital is excellent. But have they got the right workforce? Have they got all the competencies to deliver? They are still working on it. And when you look at America, that's another example. I spent my life in a few years in America, and I realized that, of course, America spends 17 or 18% of their GDP on healthcare, but still their outcomes are not as good. But on the same note, they have got the best, most researched, most developed medical system in the world.
Hmm. I see. Wow, very interesting. And since you work successfully in multiple countries, what are personal or professional principles have helped you to adapt and succeed in these varied systems?
Well, I think the principles. Uh, Let me say it in this way. I think it depends at what stage of your career you're on, right?
Yeah.
Initially, early stage of your career, you're very operational, right?
Hmm.
You are hands-on. But as time goes by, you become more experienced, you get leadership role, you become more strategic. So the personal and professional principles which underpin your achievements, whether operational achievement or strategic achievement. In my case, I felt you need to be a very competent and need to have a very good knowledge. So that's the reason when you asked me the question earlier that what's my key milestone, I said the
Hmm.
academically, maybe six, eight discipline, and I have got professional qualification. But the most important thing that I wanted to be a passionate person who understand, learn, and absorb knowledge, and then apply that knowledge. When you apply any knowledge, it become your competency. So that's the first principle. So I've got love to learn about health
Hmm.
systems and how best you can change things.
Yeah.
Then the personal side, I think the goal is to work with the local leaders. So I think I'm very flexible, try to develop the flexibility. When I work in other countries or advise other countries, I don't go with my own solution or the solution of the country, which
Hmm.
is in this case UK. You need to learn and understand from the local leaders what are the key challenges and what are their views are. And the most important principle, which I feel is very useful for your audience who are listening to this, is listen. It's very important that you need to be having a listening skills. And then when you're listening, it is not about what is right, it's not about who is right, it is what is right. So these are the key principles which I've utilized for my personal and professional growth, and also to make an impact on the ground.
Mm-hmm. And what would be the one project, yes, or one challenge that you resolved that you're the most proud of?
Uh, I think there are many challenges, professional challenges, organization challenges I've been part of. And I think my being proud of there are many, but it is not because of me, but it is because of the team approach. And I always say that anything you achieve in your professional life, it is not just because of you, but it's the team you work with and the team you work in. So I think if I go back, I remember there were Commonwealth Games in Manchester in 2002, very early days when I became consultant. I was given the responsibility to
Mm-hmm.
deliver the health services for the whole games. And I think later on, my experience was used for the London Olympics. So that's one. Then I established the Care Quality Commission, which is having an impact on 30,000 and more organizations, improving the quality and the value of those organizations in England. Then, of course, I served the Public Health Scotland as medical director, and I had the opportunity to learn within the organization and to deliver for the organization. For example, we did a lot of things on data and digital front. We developed Atlas of Variation, which shows that what are the variation within Scotland on the delivery of the healthcare services and many other digital tools.
Mm-hmm.
Then, of course, when I was asked to become advisor to the Minister of Health of Qatar, she was very kind to ask me that I should lead on the quality, on the transformation, and I established the first national quality committee. I helped them to develop the national quality framework and also to build the consensus how best the quality should look like. And of course, the on the academic side, I've been teaching, and I think I'm very much proud of many of my students who have been, or many of my trainees who are
Mm-hmm.
now delivering in the NHS and abroad.
Wow, that's very impressive. And for students who are at the university at the moment, how can they become as successful as you are in the future?
Well, it depends how you define success because all of us have got different views about success. I say to myself that success means that how best you can help and improve the quality of life of people because I am in life-saving business. And so healthcare is adding life to years and years to life. So you can improve the quality of life people or you can help them to live longer. So this is the purpose. So I think what I'm trying to say is that you need to be very, very clear about your purpose. Once your purpose is very clear, it doesn't matter you're a doctor or you're an engineer or you're working in an oil rig. At the end of the day, your purpose needs to be very, very clear. And once your purpose is clear, then you need to be thinking what professional knowledge and competencies I need to be successful. And I always say that to be successful, whatever the way you define success, you need to think that what are your most important asset, which you can use to achieve that goal. And the most important asset, in my view, is your time.
Mm-hmm.
Because everyone, each one of us, 7, 8 billion people living on face of this earth, have got 24 hours, right? And for 1,440 minutes. So it means we need to use that time effectively. So the difference between a successful and not successful person, if you look at how the people have utilized their time, I think that might be one of the key factors. So I think that would be my advice. And then I think again, as I said, some people think about success that's the hierarchy in career. Some people think that how much wealth you can gain. Some people think how much qualification. So I say you need to have a balanced approach to success. And in my view, I always thought, I mean, my mentors helped me, my teachers helped me to build that approach and thinking that there need to be 4 or 5 elements of your success.
Mm-hmm.
First, of course, your work success, that how best and how useful are you within your profession to help others. That is
Yeah.
work success. Second is that you need to be thinking about that how best you can uh, earn more. It means that you need to think that you have got family and life, and how best you can be having the more successful in terms of the income. And that shouldn't be the main goal. The first goal, I already said, the work and career, then the income.
Mhm.
Third thing is a relationship, because people might have seen in their lives that they are successful in one area, but they become unsuccessful in another. And I think the relationship, the family relationship, the friend relationships, and your colleague relationship become paramount. And then, of course, you need to think spiritually that how best you can have a balancing life, because at the end of the day, you need to be happy person and healthy person. The fifth one, I say maybe the second most important, you need to be healthy. And health means physical, mental, and social well-being. And
Mhm.
I think even if you are a very successful in your career, but you are not healthy, you won't be able to deliver. So it's not a message from me as a doctor, but it's a message from me as a leader that you need to be thinking on those five elements of your success and try to act as a balancing approach. I think going extreme on one end, it means that you will lose on the other three or four elements. So I think that would be, in my case and in other case, would be a very rounded approach.
Wow, that's an amazing advice. And the last question is, what advice would you give particularly to yourself, to your younger self, when you were like a student or something? Yeah.
Right. I think I already mentioned the time is your biggest asset. And again, you need to think about your high yield activities. I always felt now, after learning the Pareto principle, 80-20, that 80% of your success come from 20% of your activity. And you need to identify those 20% carefully in those domains. What 20% you will do, which can give you 80% help. And I think the other advice I will give to myself is that you need to be listening more, because this is again your communication. I think the future leaders, future professionals, I think they need to be rounded people. They shouldn't be very good in the competencies and the profession. They need to be a very good rounded leader. And for that, you need to be having a good communication skills. You need to be listening people rather than telling people. I think that would be the advice I would have given to myself. And I learned, and I think this is, and then don't try to prove that you are right. Try to prove what is right for the system, what is right for the patient, what is right for the company you are working for, rather than you say that what is right for me or whatever I'm saying is right. So I think that is emotional intelligence, and I think people need to develop more of the emotional intelligence.